And when it comes to coronavirus, we're seeing those case counts spiking all across the country. Case counts around the country right now, according to that Johns Hopkins University COVID-19 tracker, they're nearing 3.4 million, excuse me. This, of course, is coming as Dr. Fauci says that the surge that we are seeing is because the United States never totally shut down. When it comes to Georgia, they are seeing a record number, 2,600 to be exact, of hospitalizations, while California, Texas, and Florida are seeing daily case counts reach an alarming 30,000. That was as of yesterday, Monday. So to stick with coronavirus here, as I just mentioned, Florida now becoming the epicenter for some of the latest surges that we're seeing as the case count spike in that state, along with California and Texas, as I just mentioned. For more on this, we're joined now by Dr. Darria Long. She's an ER physician in Georgia and Tennessee and clinical assistant professor at University of Tennessee School of Medicine. Dr. Long, thank you so much for joining us today.
Thank you, Kristin. Great to be here.
So I just highlighted some pretty alarming numbers, at least when it comes to the case counts that we're seeing and the spike that we're seeing as well with the hospitalizations. So we're now starting to see some states say, hold on, we actually need to backtrack on some of the reopening. California, of course, making that call. Should other states be following suit? I'm thinking particularly Florida here.
Yeah, I think we're seeing that with California. You're right. The other states, every state needs to look at their current rate of prevalence and their rate of positivity, their hospitalization. And yes, we do need to do the smart things. The problem here is not that we didn't shut down. It's that when we reopened so carelessly and with lack of any uniform strategy. So I don't want anybody to have to shut down again. We wouldn't have to make giant steps like that if we could do the small, smart things that we know. Masking, pay attention to the 4Ds of distance and density and duration. If we could just get that under control, Kristin, we could avoid these giant steps.
So as I mentioned, a little bit earlier, Dr. Fauci saying, listen, we're seeing these spikes and these surges around the country because, well, frankly, we never decided to fully close and stay at home. What you're seeing right now, would you call it at all a failure of leadership on a state level, a failure of, perhaps the state's governors, or even failure on the federal level, from the president in not taking this seriously enough?
I think what we are seeing is a failure of leadership on many levels, whatever levels you want to call it. What we do need is you need centralized guidance, but you need it to be executed at the local level because everybody's prevalence is going to be different. Your density of people is going to be different. If we could do that, part of the problem is businesses don't have that predictability. So they feel like they're getting, it's ping pong and you can't build a business strategy on that. If we could start now. It's never too late to say, these are the metrics. This is the federal guidance. Everybody needs to follow it, but execute it at the local level, whether that's for your government, whether that's for lockdowns or going back into phase one, and also how we do schools.
So to that point, schools, I'm really glad you mentioned it because I want to ask you about that next. What should we be doing in the fall? We are hearing on the one hand, the president, Education Secretary Betsy DeVos saying we need to reopen schools in the fall. And then on the other hand, we're hearing unions, parents saying, I do not want to send my kids back to school.
Yeah. So Kristin, I'm an emergency room doctor, as you mentioned. I'm also a mom of two. My kids are 3 and 6. So this is something that I am thinking about professionally and personally. And I think there's a couple of different things. I think we could send back children to school. We know that children are likely less of a vector. That doesn't mean we shouldn't be taking the protective measures. Why can't we send our teachers with appropriate PPE, with N95 masks, with things to protect themselves like we're doing in the hospital? And if it's that we as a country just can't make enough N95 masks, then shame on us. What's going on with our infrastructure that we can't make the PPE that we need? I think an important other thing is it depends on your community prevalence. No matter how great your school is, what we know is if you have rampant COVID in your community, it's going to still spread in the schools. We've seen that in European countries. Those that had the disease under control and lower prevalence were able to open successfully. Those that had rising prevalence opened, they had more outbreaks. So we need to get that all under control so that we can get our children back learning. And we also need to be, I hope they take this time to plan that virtual classroom because we know there will be children who can't go into the classroom. We need to have a better virtual learning system for the entire next coming year.
So a lot of people are saying that the new numbers that we are seeing essentially are younger folks that are becoming sick. Is that all down to just the fact that younger people are no longer social distancing? Or is there something that's happening with this virus that we're now seeing younger people getting sick?
Yeah, I don't think it's anything in the virus per se. You hear rumors of mutations and things. I don't think that's what's driving this. I think we were seeing younger people get out. They weren't social distancing. So 2 to 3 weeks ago, that's when we saw the numbers start to rise. And what we said back then, I think I was on the show talking about it, is we have to watch because the rates could be rising in young people. What's going to happen in 2 to 3 weeks as those young people interact with more medically vulnerable people? Then we're going to see what we are in fact seeing now, which is rises in hospitalizations. So again, if we could get the entire population to be more careful, then that's going to lower our prevalence and that will lower our hospitalization and ICU stays.
So as you mentioned, and as I mentioned as well in the intro to you, you are an ER doctor and you are also in Georgia, which, as I had also mentioned earlier, is seeing that pretty alarming number of hospitalizations rise. I mean, as an ER doctor, how concerned are you that some of hospitals in some states, in some cities, might become too overwhelmed to take on all the patients that need to go to the hospital?
Yeah, I think, Kristin, we're getting there. I spoke to a number of fellow physicians at a number of different hospitals to kind of get a quick informal survey. And most of them still have capacity, but they are nearing the end of the capacity. A lot of hospitals are boarding patients in the emergency department. And Kristin, part of the problem, you can have all the ventilators and beds and turn a stadium into a hospital if you want. But if you don't have the nurses and the doctors and the environmental sanitation workers and the human beings, which is where we're starting to see shortages now, you're seeing hospitals having to shut down wings, that's when we're going to have a capacity problem. So we can't just think that we can build our way out of this. We actually have to look at the true hospital capacity and keep it under that capacity. If we can do that, then the hospitals can take care of the people who get sick, but we can't exceed that capacity.
So on the vaccine front, we routinely have been getting, pops of optimistic news on the vaccine front. We keep asking, doctors, do you actually think that it's going to come out in January? But I want to ask you something a little bit different. How necessary and how critical is it for the United States moving forward in our, fight against coronavirus to get this vaccine out to as many people as possible?
I think a vaccine would be a really important step. And yeah, when is it going to happen? Is it January 2021? Is it sometime Q1? We don't know. But really interesting are the discussions they're having about prioritization, because we're not going to suddenly have enough vaccine for the entire population that needs it. Who's going to get it first? And I think if we look at the most vulnerable populations, it looks like they're going to give them to healthcare workers on the front lines, like myself, taking care of COVID patients, and then those most medically vulnerable patients. If we can start there, then we can make a major step in towards getting more immunity towards this virus and getting this virus more under control. So yeah, a vaccine is a key component, especially for the vulnerable populations.
All right, we'll have to leave that there. Dr. Darria Long, Clinical Assistant Professor at the University of Tennessee School of Medicine. Thanks so much for today.
Thanks, Kristin.
Hey, investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.